Hi, everybody. This is Steve Sabludowsky, Bayoubuzz.com, and today we have a healthcare expert, Sally C. Pipes from the Pacific Research Institute. I'll give more information in a few seconds. Good afternoon, Sally.
Good afternoon, Stephen, and nice to meet you.
Oh, my pleasure. Thank you so much. So we're going to be talking about healthcare and specifically Obamacare, and specifically we're going to be talking about I guess we'll call it Trump care. So I saw the article that you contributed to Forbes, and if you could tell me, I mean, you seem to be, I would assume, excited now that there's a chance that Obamacare might be no more.
Well, yes. I mean, it was a surprise victory that, for Mr. Trump. But actually, I put some money on his winning after he said on November 1st in Valley Forge that he was going to win. He was going to set up a special meeting right after the inauguration to repeal and replace Obamacare. And since so many people were disaffected and have been disaffected by Obamacare, and particularly with the premium increases, the high deductibles, I thought there is a chance Mr. Trump will win. So yes, I am excited. I'm cautiously optimistic, though, because there are a few things in his plan that I don't agree with. But the names that are being touted for the Secretary of HHS, there's some very good names there, including Dr. Tom Price, a member of Congress who's very good on healthcare. He's a medical doctor. So cautiously optimistic that Obamacare will be repealed and replaced. That would have to, of course, be done through budget reconciliation because the Republicans have only 51 seats in the Senate, and to actually repeal the whole bill, they would need 60 votes so that in order for it not to be filibustered.
Right. Just to let you know, I believe that here in Louisiana we have our U.S. Senate race, and the Republican is most likely going to win, but that obviously is not going to affect the filibuster. You still would have the same issue in terms of reconciliation. I just want to make that point.
Right.
And so what is it that you just really don't like about the Affordable Care Act, if I might ask?
Well, there are a number of things that I don't like about it. The individual mandate, the employer mandate, the way the subsidies were set up, the essential benefit plan, which means that insurers have to provide a plan that covers all of these various rules, mandates, regulations. So there are many aspects of it. I don't like the individual mandate of $695 or 2.5% of income, because it didn't encourage young people to sign up for Obamacare, and so I don't like that. I don't like the mandate that it was put on employers. I don't like the Independent Payment Advisory Board, which was part of it, but has never actually been implemented by the president. And I'm hoping that it will be removed in the repeal. I also don't like the Medicaid expansion part. 19 states have not expanded their Medicaid programs, but it's led to tremendous increase in cost. And the people that, now the additional 15 million people that signed up for Medicaid under the expansion plan, many of them now, instead of going to the doctor, the problem is that doctors won't take these Medicaid patients because the reimbursement rates from the government are so low. So contrary to what the President Obama wanted, more of these Medicaid people are now going to emergency rooms for their care, which was not what was supposed to happen.
Oh, okay. Let me just ask about that. And I'm just wondering whether or not the issue is the state actually receives the money. And you're saying that the doctors, the hospitals, et cetera, are not accepting that, they feel like the payment's not sufficient?
Right. The reimbursement rates are too low. And so there are about 76 million people in America on Medicaid now, but so many of them are having a hard time, getting an appointment with a doctor. The waiting lists are long, or doctors are saying we are not taking these Medicaid patients. So emergency room use, which is very expensive care, is on the upswing according to the latest studies that we have just seen. Those states that did take the extra funding, the 31 states plus the District of Columbia, are finding, that the tremendous increased cost in their budget, even though they're getting funds from the feds for this expansion plan.
Okay. Just out of curiosity, they didn't have the Medicaid expansion, such as in Louisiana, we didn't have it. This past year, they opted into it, change of governor. So those people in, say, like Louisiana, those people who are now on Medicaid expansion, they would have basically the same situation they had before?
Well, I think what's going to be interesting will be to see, what the reconciliation bill looks like, and if the Medicaid expansion is going to be eliminated, what will the Secretary of HHS do? And of course, your former governor, Bobby Jindal, is one of the short names on that list. What they will do. Mr. Trump has said that he believes in the same way that I do, and that the Speaker of the House, Paul Ryan, does, that the best way would be for the feds to send the money in a block grant to the state and let the states design their Medicaid programs, one that best suits the residents of, say, the state of Louisiana.
Right. So, yeah, we have heard about Governor Jindal being on the short list. We're having some real problems in Louisiana, budget-wise. Yeah. So
I made my first visit to New Orleans about a month ago, and I found it was really a fascinating city, and the whole French Quarter and stuff. But I can see there are a lot of problems. A lot of people left Louisiana after Hurricane Katrina, and I guess have not returned. So you've got some problems with your economy, etc.
Yeah, definitely. But I mean, considering making a really great comeback. So, what part of Obamacare do you find any part of it acceptable?
No, actually, I don't. I mean, when you look at the size of the U.S. population, we're 330 million people. In 2016, the administration and the Centers for Medicare and Medicaid Services said that 12.8 million people had signed up for Obamacare. And of course, 85% of those people are eligible for the subsidies from the federal government. But it's a very small number, and they've actually, the CMS, HHS, the Department of Health and Human Services, have downgraded that 12.8 million number to about 11.1 million. It'll probably go even further down when all is said and done, because a lot of people that sign up, A, do not pay the premium, or B, can't prove that they're American citizens. So it's a tremendous cost for a very small number of people. And then when you look at the difficulties that these people are having because of the premium increases, so say you have 20 million people, about say 11 million on the exchanges, and then about 9 million who signed up for individual coverage. When you're looking at premium increases for next year on average of 22%, and for those people on the healthcare.gov in the 39 states, where their premium increases are going to be supposedly 25% increase, contrary completely to what the president promised the American people when he said the average family would see their premium go down by $2,500. So premiums are way up. A lot of these people that are that now have coverage, these 20 million people, they're finding it difficult to pay the premium. But with a deductible in the range of $6,000 for an individual and about $12,000 for a family, they have coverage, but they can't afford to use it because they can't afford to pay that deductible. So it really, what good is having insurance if you can't afford to use it? So we need to get rid of, we need to repeal and replace Obamacare, and we need to get rid of the essential benefit plan. So a lot of these people could then get the type of plan that they can actually afford and suits their needs, and they don't have to cover, all of these essential mandates, which add 20 to 50% to the cost of a premium.
Okay, let me throw some out to you, because I'm really looking for an answer to one major issue as I see it. And let me just give you background real quick, and that is about over 2 years ago, I just suddenly thought in a conversation I was having with two other attorneys, I was thinking, well, if they repeal Obamacare, that means anytime you repeal something, it's over. Okay, the law is over. And so that's something, I asked my fellow attorneys, well, what happens if you repeal? You have nothing, right? I mean, do you go back to where you were? I mean, what happens? You have this ending. So I decided, to investigate. I started writing about it. Wrote, we had a couple of elections. Start throwing it out. Hey, somebody tell me what to do here. Tell me what the answer is here.
Well, I mean,
yeah, and I wrote about it during the election, this most recent election. I still haven't gotten any answer about it. And I did see that. Let me just finish. I did see that on CBS. The question was asked Trump about interruption, and he denied that there would be any interruption, and also said that he wanted to have pre-existing conditions coverage, and of course the insurance for up to 27 years old, I believe. I don't get it. I don't see how. I'm not saying Obamacare should stay, but I just don't see the connection. How do you end it suddenly and still have insurance?
Well, of course, it's not. I mean, it is not going to end suddenly. I mean, if they do repeal the major budget parts of Obamacare under budget reconciliation, they're going to have a replacement agenda ready to go, whether it's going to be part of that reconciliation or whether they're going to introduce new legislation. But as Trump has said, and as Paul Ryan has said, and as I have said, first of all, there will be a transition period for the exchanges, so probably a 2-year transition. And you have to remember that a number of the insurers, Aetna, United, Humana, Anthem, are probably not going to be, they're going to get out of a lot of the exchanges next year.
Sure.
Aetna's only going to be in 4 states. So, but the exchanges will continue for 2 years. The people will be
if the law is repealed, though, if the law is repealed,
then it can't be repealed, though. It can't be fully repealed. That's the issue, because they're only going to be able to use budget reconciliation, which will only get rid of the budget part of Obamacare. And then they're going to come in with a replacement that, allows the exchanges to continue for 2 years, kids to stay on their parents' plans till age 26. The idea about the people with pre-existing conditions, that these are people that are in the individual market, not employer-based, but they would be able, as long as they continue to pay their premiums, they couldn't have a tremendous increase. And then there will be high-risk pools introduced at about $25 billion over 10 years from the Fed, so that people with pre-existing conditions would be able to purchase affordable coverage in those high-risk pools. So those things are, going to happen, because they can't repeal the whole law under the present 51 people in the Senate.
But even if they had 60, if they repealed it, there was nothing to replace it, the insurance companies could say, well, I'm sorry, but you're covered under Obamacare. It doesn't exist anymore. See, that's one of the things that I've really had a problem with, because for 60 times Republicans were saying we're going to repeal, but it would end insurance for these, for these people.
Well, it won't, because as I said, there's going to be, and it's been promised by Trump and by Ryan, there will be a replacement agenda.
This time, this time there will be because of the reconciliation. Because
there will be a replacement. There will be a replacement agenda, and if you look at what's in Paul Ryan's A Better Way, they're going to get rid of the employer mandate, the individual mandate, but insurance companies will then be able to offer a variety of products that have different types of. If I want a health care plan that covers alcohol rehabilitation, I should be able to get one, but you shouldn't have to buy one that has that you have to bear the burden of what it costs me. So we'll have state-based tort reform. We will block grant Medicaid. There will be changes to the Medicare program, because when it came into being in 1965, it happened. People only lived to age 65. Why should people like Warren Buffett be eligible for Medicaid. We will have, it will level the tax code so that, because people who have 155 million people who have employer-based coverage, they get their coverage tax-free. But if you're in the individual market, you have to buy your coverage with after-tax dollars. We need to level that playing field, and then then what will happen is they will also bring in age-based refundable tax credit. So if you're younger, your tax credit will be lower. If you're older, it'll be higher, and will go to you, the person, so that you can purchase the type of coverage that you need. So we've got age-based refundable tax credits. We will have high-risk pools. We will be able, people who keep their coverage on a continuous basis won't be subject to huge increases in their costs. So there's a number of things that are in a replacement plan. It's not going to be Obamacare is gone and there's nothing to replace it.
Okay, so two last questions. One, in terms of the reconciliation, that means that it will be, assuming that it passes, and I have no doubt that it will, that means what will happen? It will be defunded. Parts will be defunded.
Well, only parts of it will be defunded. Of course, they have to also, through a continuing resolution, get a budget passed because, up till September 30th, 2017. So they will, under the reconciliation, they will end the individual employer mandate, the subsidies, the Medicaid expansion, and IPAB. But then they're going to right away reintroduce this replacement plan, which I've talked about what the components of that will be. So people will not be left, the 20 million people who have either exchange coverage or individual market, they will not be turfed out onto the street. But they will have options to get a different type of plan. And as I said, a lot of those people who have plans now can't afford to use them. So it's basically useless.
Okay, when would they introduce that replacement plan? I mean, it would immediately,
Well, there are two ways they can do it. One, they would introduce a reconciliation bill, which would include repeal and replace, or they will do the reconciliation bill, and then shortly after that, they will introduce the replacement plan. I mean, I'm not part of the transition team or the administration, so I don't. But that's what's out there. That there's two ways that it'll be done.
And just I guess the last question on this point, and that is, if they repeal, they would have to have the replacement plan sewed up, tied up. Because otherwise there will be a gap.
Right. No, and they've made that very, very clear. So it's the replacement plan is there. The American people, I think the reason that Trump won the election is because when the people realized what was going to happen to them in 2017 with their premium, their deductible, and the small network of doctors and hospitals that are available, and in many states they would only have access to one plan, and many states only HMO plan, which the American people don't like. So this is what the American people want this, and the newly elected president and the House and members of the Senate realize this, so they're on board to bring that replacement plan in right away, either as part of the repeal and replace, or repeal with a second replacement plan right away, right after the inauguration as well.
Gotcha. I really appreciate your explaining this. I'm sure I have some other questions that may hopefully at a future time.
Right.
Yeah. I really do appreciate. I need to think about the various things that you've said and try to figure out whether or not. I'm sure the House needs to look at that also. I don't know if they really have thought through this. But hopefully.
Well, I hope they have. They ran on it. They promised it to the American people. So
it was very general, though. We're going to repeal and replace. They didn't go through the system, the questions. I think
a better way, which is the Ryan plan, which is a really good plan. Now the issue is they have to turn that into a legislative bill and then bring out the cost. How much it's going to cost. They have a lot of work to do.
Yeah.
But that's what we, the taxpayers, are paying them for.
Absolutely. Thank you so much. I really appreciate it. Really.